in this video we will see the anatomy of spleen. So this is the spleen. Here we can see the duodenum, the pancreas, and this is the spleen, which is the lymphoid organ, and it's for the filtration of the blood. It is located in the left hypochondrium, and sometimes it reaches up to the epigastric region. And these are the specimens for the spleen. Here we can see the dimensions of the spleen. It is 5 inches long, 3 inches broad, and 7 ounces in the weight. Now the ribs which are related to the spleen, these are 9th, 10th and 11th ribs. So these are the 3 ribs which are in contact with the spleen at its location. So for placing this in anatomical position, we hold this spleen like this. The anterior end, that is the broad end of the spleen, should be at the mid-axillary line. So this is the anatomical location of the spleen. Now the external features of the spleen, these includes 3 borders are there. This is the superior border. It can be identified by the notches. Then this is the inferior border, the lower border, and this is the intermediate border. In this we also can see the superior border, which is notched. This is the inferior border, and this is the intermediate border. Now the surfaces, this is the diaphragmatic surface which comes in contact with the diaphragm, and this is the visceral surface. On the visceral surface we have the relations which we will discuss later on. Now ends of the spleen, there are 2 ends. This is the anterior end, which is broad, and this is the posterior end. At the anterior end we have 2 angles. This is the superior angle, that is the anterobasal angle, which is between the superior border and the anterior end. So this is the anterobasal angle. It is also known as clinical angle because it is enlarged during the diseases of the spleen. And this is the posterobasal angle, which is between the anterior end and the inferior border. So this is the posterobasal angle. So these are the 2 angles in the spleen, and 2 ends are there. This is the anterior end and this is the posterior end. Anterior end is broad and posterior end is narrow. Now the relations of the spleen. Spleen is related on its diaphragmatic surface with the diaphragm, and on its visceral surface it is related to some viscerals, like at the upper part this is related to the gastric. So this is the gastric impression, and this lower impression is related to the kidney. So this is the renal impression. Then at the close to the anterior end, this is related to the colic part, that is the splenic flexure of the large intestine, and behind that we have the pancreatic impression, which is for the tail of pancreas. Then this depressed area which is giving passage to these vessels, these are the splenic vessels, and this depressed area is known as hilum of spleen. At the hilum of spleen we have the splenic artery and the splenic vein, and the nerve plexus and the lymphatics which are supplying to the spleen. Then the peritoneal relations of the spleen, these include the lienorenal ligament, which is from this kidney up to the hilum of spleen, and the gastrosplenic ligament, which is from the greater curvature of stomach to the hilum of spleen. Then indirectly it is related to the phrenicocholic ligament, which is from the splenic flexure of the large intestine up to the diaphragm. So the anterior end is coming in contact with the phrenicocholic ligament. Now in this cadaver we also got the accessory spleen. This small part, this is the accessory spleen, in which the extra splenic nodules, they develop in the vicinity of the spleen, and these are the splenic vessels which are supplying to this accessory spleen. So this is the accessory spleen. Thanks for watching.